Hello everyone. I will be discussing the APGAR score, a vital tool used to assess the health of newborns immediately after birth. APGAR score is essential in guiding clinical decisions, especially in determining whether immediate medical intervention or resuscitation is needed. Understanding this scoring system is key for healthcare professionals working with newborns as it provides critical information about their well-being. So what is APGAR score? The APGAR score was introduced in 1952 by Dr. Virginia APGAR. She was an American anesthetist. Dr. APGAR developed this system to assess the clinical condition of newborn immediately after delivery. And the goal of the APGAR score is to quickly evaluate whether a newborn requires immediate medical intervention or resuscitation. This scoring is done at two crucial moments, 1 minute and 5 minutes after birth. The first minute assesses the newborn's initial adaptation to life outside the womb, and the 5 minute scores provides insight into how the baby is responding to any intervention or resuscitation efforts. It is simple to perform, quick, and effective, providing healthcare professionals with a clear understanding of the newborn's immediate health status. What does APGAR stands for? As I mentioned earlier, APGAR is an acronym that stands for five key clinical signs observed in a newborn, each assigned a score based on their condition. A stands for appearance. This refers to the baby's skin color, which reflects oxygenation and blood circulation. P for pulse or heart rate. This evaluates the newborn's heart rate. G for grimace or reflex irritability. This is a measure of the newborn's response to stimuli, usually by suctioning the nose or rubbing the back. A is for activity, that is the muscle tone of the newborn. This assesses the baby's muscle tone, which reflects their level of neuromuscular activity. And R is for respiration. It looks at how well the baby is breathing. Each of these five signs is evaluated, and the scores are combined to give a total APGAR score. The score ranges from 0 to 10. There is another term used as an expanded APGAR score. In 2015, the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists recommended an expanded version of the APGAR score. This update does not change the core five clinical signs, but it does emphasize the importance of continued monitoring and scoring. If the 5 minute APGAR score is less than 7, in such cases, healthcare professionals are advised to continue assessment at 10, 15, and 20 minutes as required. This extended observation period helps doctors and nurses monitor the infant's progress and responses to intervention like resuscitation, offering additional insight into their recovery or need for further support. Let's break down how the scoring is carried out. As I mentioned earlier, APGAR is an acronym that stands for five key clinical signs observed in a newborn, each assigned a score based on their condition. First one is the appearance, that is color of the newborn. Score of 0 indicates a baby who is pale or blue all over. Score of 1 is given if the baby is pink but the extremities are blue. Score of 2 means the baby's entire body is pink, indicating healthy oxygenation. Regarding the heart rate, 0 score indicates that there is no heartbeat. 1 is for a heart rate of less than 100 beats per minute, and 2 score is given for a heart rate greater than 100 beats per minute. Reflex irritability. In case of score of 0, it indicates the child is not responding at all. A score of 1 indicates a grimace or weak response, and a score of 2 indicates a strong, vigorous cry or reflex action. Regarding the activity, score of 0 indicates that there is no movement or limb muscles. A score of 1 means some movements or flexions of the limbs are there. and score of 2 indicates active movements with good muscle tone. As far as the respiration is concerned, a score of 0 is given if the baby is not breathing at all. A score of 1 is for weak, irregular breathing or slow breathing. And score of 2 is given for strong, regular, and effective crying child. At 1 minute after birth, the APGAR score gives healthcare providers an initial understanding of how well the baby is adjusting to life outside the womb. This score is critical because it helps determine if immediate resuscitation is required or not. And at 5 minutes after birth, the APGAR score assesses the effectiveness of any intervention that may have been performed. If the score is lower than expected, such as below 7, additional medical steps may be needed. In both cases, the healthcare team will assign a score of 0, 1, or 2 for each of the 5 clinical signs. These scores are then added together to give a total. A newborn who scores 7 to 10 is generally stable and does not require immediate medical intervention. A score between 4 and 6 suggests some distress, and the baby may need additional support like oxygen or stimulation. A score of 0 to 3 indicates severe distress and requires immediate resuscitation. So, what is the significance of APGAR scoring? The APGAR score provides a quick, standardized method to assess the immediate health of a newborn. It plays a key role in determining whether a baby needs resuscitation or if additional medical interventions are necessary. Here are some significant correlations between APGAR score and infant health. A low 5-minute score, that is 0 to 3, indicates that it is strongly correlated with neonatal mortality, meaning if a baby scores very low, there's higher likelihood that they may not survive. APGAR score of less than 5 at 5 and 10 minutes. These scores are linked to an increased risk of developing cerebral palsy or other long-term neurological disorder. A low score suggests that the brain may not be receiving enough oxygenation during the critical moments after birth. APGAR score less than 3 at 10, 15, or 20 minutes indicates the increased likelihood of poor neurological outcome. The longer the baby remains in distress, the higher the risk for developmental problems. It is a very important question that when should a healthcare provider discontinue newborn resuscitation? In cases where a newborn APGAR score is 0 at 10 minutes, resuscitation may be discontinued as it indicates that the baby's condition is not improving despite efforts. However, this decision should always be individualized and consider the context of each case. For example, if there is any potential for the baby's condition to improve, or if the circumstances around resuscitation change, a decision to continue efforts might be made. So, in conclusion, the APGAR score remains a cornerstone of newborn care. It provides an immediate snapshot of a baby's health status after birth. Despite its simplicity, it has proven to be incredibly effective in predicting both short term and long term outcomes for newborn. These are the few references. See you in the next lecture.